Good evening, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare in honor of World Heart Day 2024. We present our special series Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with a vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And today, for the episode, we have with us Dr. Aparna Jaswal, Director of Cardiology at Fortis Okhla. She is an expert in cardiac pacing, electrophysiology, with extensive experience in RF ablation, ICD implantation, and pioneering the first EP program in Mauritius. Dr. Jaswal has been at forefront of cardiac care. She is also a certified cardiac device specialist with international training and has contributed to numerous research projects. We are excited to hear the insights on heart health and innovation in treating arrhythmias. So let's begin for the today's topic of discussion, this, which is focusing on sudden cardiac death, heart disease in women, and prevention. Welcome to our show, Dr. Aparna.
Thank you so much, Simran, for having me here. And I'm excited. And I think in the next few minutes, I will try to justify the pointers which are extremely important why keeping our heart healthy is so vital.
Yes, we are looking forward for the same. So, starting with the conversation, Dr. Apanna. So, sudden cardiac death is a term we often hear, but many people don't fully understand what it means. So, could you explain what sudden cardiac death is about and what typically causes it?
Yeah, so as the name implies, sudden cardiac death. It comes suddenly and is a death because of a cardiac cause. So that's sudden cardiac death. And we often say this. If anybody knew that he is going to get sudden cardiac death, he would obviously have rushed to the hospital. So, sudden cardiac death is like a bolt out of the blue, unexpected, and the death happens within 1 hour. So, sudden cardiac death is actually a menace, and you would be surprised to understand as to how many people succumb to sudden cardiac death every year. So, if we were to take the data, which is pre COVID, we used to say per thousand, one per thousand in this whole world per year die. So it's a very high number of sudden cardiac deaths which happen throughout the world. Sudden cardiac death is most often, more than 80% of the time, is because of blockages in the blood vessels of the heart. We know there are many other causes also. As the conversation goes by, we will be touching that. But the focus must always remain that more than 80% of the time it's because of blockages in the blood vessels of the heart, implying the importance of exercise and eating right so as to protect your blood vessels from blockages.
Thank you so much, Dr. Apanna, for explaining that to us in a very simple term so that all our audience can understand this. So, since we're talking about this sudden cardiac death, so what are the warning signs and preventions would you, recommend to us and to our audience so that they all are aware of this?
So, sudden cardiac death, as the name implies, is sudden, but yes, it does give us some warning signs. So, what are those warning signs which often go neglected? So, the most important warning sign is that when you walk or you go uphill or you climb a flight of stairs, you have chest discomfort right in the center of your chest. It will feel as if somebody has sat on your chest or somebody has tied your chest with a very big band, and that pain or discomfort can even come to your jaw. It can go to your shoulders and can also go to the inner side of your arm. That is what we call angina. Angina is meaning that there's a pain arising from the heart because the blood vessels are being obstructed. The muscle of the heart is not getting adequate blood flow, as a result of which it presents itself with the classic symptoms as I just explained. We have to remember that sometimes the symptoms or the warning signs may not be as clear as this, especially in a woman. It can be very odd, like for the very first time, the patient feels nauseous or feels very funny, which a patient has never felt before, along with a lot of sweating. and it is often blamed to be gastritis. Remember, if you have any symptoms that you've not had in the past, do not blame it to be gastritis. Rather, seek an ECG to be done. So, one of the warning signs is chest discomfort. The other warning signs potentially could be breathlessness on walking, which was not there before. The third warning sign can be that you feel dizzy. There have been times that you felt dizzy, or there was blackening in front of your eyes and you felt that you'll fall down, but you just kind of managed to control yourself. So, these are some warning signs which should not be ignored. And if you have any of these symptoms, do visit your local doctor and get an ECG done or an echocardiogram done.
Thank you so much for those steps, prevention, and that warning signs to be aware of. And I think these will be very helpful. But since we're talking about talking about heart disease, so I want to relate this to women health as well, because recently in past few days I just saw some video on Instagram that shows that women's heart disease sign or heart attack sign is bit different from what men faces, right? So if we're talking about heart disease, is often thought of as condition that primarily affects men, but does it a significant issue for women too? And can you tell us about how heart disease manifests differently in women?
Okay, so first let's talk about how does it manifest differently in women. As I told you, it may not come with classic angina. It may come with a
Hmm.
very odd kind of a sensation. It could be just nausea. It could be just pain in the shoulders or pain in the jaw. Any of these symptoms or profuse sweating. Any of these symptoms could be arising from the heart. Coming to your first question now, which is extremely pertinent, that is heart disease a man's disease? Well, the answer is no. We have always read traditionally that women are protected by their hormones. The women hormones, the estrogen, progesterone, keep us protected. However, there has been certain changes globally that we have done as women folk. We have gone out to work. We've taken immense stress upon ourselves. We smoke. We take alcohol. We juggle work and home. The stresses are far more and beyond. We eat the food which is junk food, not made at home, high in cholesterol, high in sugars. More and more of us are diabetic. More and more are hypertensive. So we are forming a perfect milieu of hypertension, diabetes, obesity, poor cholesterol, not exercising, coupled with stress, coupled with air pollution.
Yes.
Remember, air pollution, which we didn't pay enough attention to, is a significant cause for heart disease. Along with this, there is something that COVID has done, and we are seeing that a significant proportion of women are also succumbing to sudden cardiac death.
I think that is a very clear cut explanation to my question, which you just answered it. So, moving on, like you also explained about the hormones level, but specific risk factors for women. What are some specific risk factors? And sorry, the warning signs. Does that differ from the men which they face?
Yeah, so for a woman, angina may not be a warning sign. It could be just feeling breathless, feeling chest discomfort, feeling nauseated when you walk, feeling just heaviness in in the jaw. So all of these are warning signs. Feeling dizzy, any such sign, if you feel, must go to your local doctor and have an ECG done.
And any lifestyle recommendation would you recommend specifically for women for their heart
Yeah,
health?
I think the most important lifestyle change is each one of us are responsible for our own selves. We must make sure that we exercise at least 30 to 40 minutes most days of the week. We must ensure that we do not consume sugars. We must ensure we eat a healthy diet which is rich in fruits and vegetables, and yes, certain amount of carbohydrates, but largely fruits, vegetables, and a good protein diet.
Thank you for that. Lastly, a message for World Heart Day as we celebrate this. What message would you like to share with the women about taking care of their heart health, staying vigilant about the signs and symptoms of their heart disease?
I think a time has come that that women must understand that if they are healthy, it will reflect upon the entire family to be healthy. It is what your children see that they will become. So it's important we pay due attention to women's health, women's heart. They must go out there, exercise every day, eat healthy, and if any symptoms, must get themselves examined and seek medical attention on time.
Thank you so much, Dr. Aparna, for answering all my questions and spreading that awareness with Voice of Healthcare to all the listeners out there, so that people out there take their heart health very seriously and are vigilant about the lifestyle they're leading, to be careful and to lead a healthy, happy life ahead. So thank you so much for that.
Thank you so much, Simran. It was indeed a pleasure, and I really request the viewers to actually abide by what I said.
Yes.
Thank you.
Thank you.
Bye bye.
Bye bye.